once you conduct these surgeries, can they be refixed? Or basically, suppose if a person comes and says, okay, I want to fix my, or maybe I need a fillers in my lips.
Yes.
And before we reach, and you conduct a surgery.
Yes.
And I'm not happy with it. Can be refixed?
Yes.
Is there a reversal module to it? Or is it that another operation needs to be done or another surgery needs to be done only as a correction?
Okay. So let me put it this way. So surgery itself is a science, and it's not a perfect science. It's not something which is like an input output module wherein you input some information and you get some results. Surgery also depends on your lifestyle. It also depends on your body, and every individual is different. Every surgeon is different. Their training, their viewpoint. So much goes into planning and executing a surgery, and then the post-operative care. Then you should not smoke. What should be your lifestyle and whatever.
The lifestyle is going to complement the surgery.
Absolutely.
In terms of making sure that it's maintainable.
Yes. So the result is not just that half an hour or 1 hour of surgery. It's also the next few months, and also preparation before the surgery. So things can go wrong. Of course, things can go wrong. But as a surgeon, it's my responsibility to take all precautions before the procedure that it's safe for the patient. And as a patient, it's so much more important to follow all instructions which have been given to the patient and give all information before the procedure. So that goes into the result. And now when things sometimes go not according to the plan, there are procedures which can be done to salvage, done to help. But sometimes these surgeries are done at illegitimate places, at places where licensing, where regulations are not that strict.
Yeah, but Dubai is a very regulated market.
Absolutely.
Even though my question was that what type of patients really do you get for reconstructive body parts? Like, I just want to understand, is it these industrial workers, or is it the guys who are working in the building contracting companies who sometimes accidentally fall down?
Yes.
Or may put up their hands in some cement machines?
Yes.
And may cut their hands off?
Yeah.
What are the type of patients that you receive?
Yeah, for reconstructive procedures, the bulk of...
Yeah, only for reconstructive as of now.
The bulk of patients comes from industrial injuries.
Okay.
Yes. Workplace injuries. Even the workplace injuries are much lesser as compared to places where it's not regulated.
So are these injuries very severe?
Not really.
Okay.
Usually these are trivial injuries as far as we see them. But imagine for a worker, losing an index finger or losing a thumb, how devastating it can be. Even though, looking at the full body, it's just a finger, but the dexterity or the...
So if he gets a finger cut,
yes,
you can refix it?
So there are ways to do it.
Okay.
If it's cut, sharp, if it's brought, in time to us.
Suppose it's dismantled completely.
Yes.
You can refix it?
It can be done. Yes. Okay. One of my first cases which I did in India was a severed hand which was brought in a bag, and it was a girl of 9 years, and operated overnight and fixed it. So these things are possible. These things are done. But then crushed
medically
injury,
it was possible.
Yes,
to connect the veins back.
It is absolutely arteries, veins, nerves,
Oh
tendons, bones. So it's a whole process.